Well, hello and welcome to Tower Talks and what I hope will be one of the most interesting podcast episodes that we've ever recorded. My name is Emry Dinman. I am the Spokane City Hall reporter for the Spokesman-Review. I'm very excited to have two guests in the studio today who have very different views on the homelessness crisis and how to address it. And as someone whose job it often is to call up people with very different perspectives and try to give either side ample space to address the views of the other party, I'm keen to see how these differences are addressed in real time. Let me quickly introduce our guests and provide a brief explanation of how I'm hoping to conduct this podcast interview. Don Kinder currently serves as the director of the City of Spokane's Neighborhood Housing and Human Services Division, which, among other things, contains the city department responsible for managing its homeless service programs. She has served in that role during the city's transition from relying primarily on a large congregate homeless shelter on Trent Avenue to Mayor Lisa Brown's, quote, scatter site shelter system, which currently includes 8 smaller shelters, some of which are tailored to certain demographics or needs. She has also previously served as the Chief Stabilization Officer for Catholic Charities Eastern Washington, which itself is a major provider of homelessness services provided in this city. Robert Marbut was President Donald Trump's homeless czar from 2019 to 2021 and currently serves as Senior Fellow of the Discovery Institute's Center on Wealth and Poverty. He has also for years been a pretty consistent opponent of housing first homelessness policies, which posit that homeless people will be more successful in treatment services and social reintegration if they are first provided housing. Robert was contracted earlier this year to create a report on Spokane's homelessness population on behalf of the Spokane Business Association, which broadly speaking argues that the city's approach to homelessness was not only ineffective, but actively attracting homeless people from outside the area. I have come today with a handful of questions, but mostly hoping to facilitate a conversation between the two of you. This is your guys' conversation. I'm just here to make sure we hit a couple of points and try to keep either side from filibustering or going too far into the weeds. This is for a general audience. So let's kick things off. Again, I want to get very broadly into your guys' different views on how the homeless crisis should be addressed, but first I want to start by talking about the study that was put out this summer. Robert, can you tell me a little bit about how you were approached for the Business Association survey and how you decided what you were going to focus on with this survey?
Well, I always focus on data, and I think without knowing your data, your specific community, there's no way you're going to address your problem. I mean, if you go into a hospital, you got to get the correct diagnosis first in order to get treatment. And there were 3 big key data things. First is you have 8.7 years average chronic in this community. That's over twice as much as Seattle at 4.2. In a good city is 2 or less, and a great city is 1 year or less. And the reason why that data is so important, that's your overall measurement of your entire system. So all the policies, all the aggregate of all the agencies, fire, police, EMS, all that, social services. The other shocking data was 50.2% of the people were from somewhere else and started experiencing homelessness somewhere else before they came here. So half your problem that you're dealing with and challenge are people experiencing homelessness who started in another city and then moved here. And then last is just the lack of roots of your street level homelessness here. 80% weren't born here, 63% don't have family here, 73% went to high school outside the area. And so taken together, that will totally change how your methodology of how you address the homelessness situation.
I have a follow-up, but first, if you had anything that you wanted to throw in here?
Well, yeah, I mean, that data is in direct conflict with the data that we submit to the federal government following their regulations. So it's confusing. I think one of my questions is, in the report that you published, you say that you observed 403 people. I don't see in the report where you indicated how many surveys were completed. So I'm curious how many surveys were actually completed.
So first off, you're right, because you used the HUD process, and the HUD asks the question very differently. And if you go to a dinner party or you go with your kids to a soccer game or something, you say, where are you from? Do they answer, last night I was staying at the hotel?
We actually don't ask where you were from. That's not the question, though.
No. I know what the HUD definition is.
But our question is, did you live in Spokane County prior to this episode of homelessness? Is our question.
That the way HUD, if you're doing the regulation of HUD, it's the night before you started experiencing homelessness there. It does not go in your roots. It's an absolute, and I'll remind
can I ask
you.
again how many surveys you completed?
Just to jump in to give people a brief explanation as to what the HUD survey is.
The HUD is called the point-in-time count, and it's a requirement of the federal government, and it asks the question very, very differently.
It's an annual survey.
It's an annual survey.
It's a physical census. We have
just
dozens
like
and hundreds of volunteers going out.
And we actually invited. Ironically, I had asked to meet with your office and you.
That's not true.
Yeah, we did ask to meet.
I never
was
received a request. We actually reached out to Gavin and did not get a response.
Yeah, and we invited both the city and the county to come out and participate. We absolutely invited.
How do you mean? Like, what do you mean?
We said, can you come out with us and do the surveys with us? So we invited.
You notified us about the day before that there was a survey planned and that we could come participate if we wanted to do the survey. We were not invited to participate in the planning. We had no idea what the motivation behind the survey was. We were not included in the methodology, nor were we asked for our own local data. That is far more extensive than the data you seem to have collected.
I've looked at all of the local data, and if you read the report, and I encourage everybody
I've read it several times.
But I'd encourage any of your listeners to go read the report. And the reason why the data is different than the federal is because how the questions are asked. Where you went to high school is probably if you ask a person with common sense across America, where are you from? Senior year of high school is generally the most given data, not where you were the night before you started experiencing.
So, Emry, I'd like to look at solutions, and high school has nothing to do with that.
Well, really quickly, if I recall correctly, you guys had 3 questions kind of related to this: where you were born, where you went to high school, and do you have any family in the area?
Yes.
And can you remind me, how is the HUD, the point-in-time count
The way that our local HMIS committee asks the question, which is in alignment with HUD direction, though perhaps not verbatim, the option that HUD provides, we frame the question as, did you live in Spokane County before you became homeless this episode? Mm-hmm. Not about last night. Not about where you went to high school. Excuse me. Can you please not interrupt? Though it's unnecessary.
You interrupted me first.
I know, because I haven't been able to finish an answer to Emry's question.
You interrupted me first.
So the one thing I asked you that I'd love an answer to is how many surveys were completed in the SBA's analysis, because that's not referenced in the report. And to your point, data is critical. Understanding our local need, the population we're serving, is essential to crafting solutions. If we don't know how many people we've surveyed, how can we assume it's meaningful data?
Because remind me, what was the sample size for the point-in-time count?
About 1,600 individuals. Mm-hmm. And the report that you wrote references observing 403, but does not say how many people completed a survey.
Again, so this may get into the weeds, sure, but it's very important to understand. The federal government has 10 definitions of homelessness. Mm-hmm. The survey we talk about only focuses on 2 of the 10. There are 5 with Department of Education. There are 5 with the Department of Housing and Urban Development. And if you read the report, it specifically talks about street level, which are the people literally living on the street and in and out of shelters.
And I understand that you guys did do some in-shelter interviews.
Yeah, there's some people that are in and out, because in real reality, in any given month, at the end of the month, more people are on the street than are in shelters. Mm-hmm. And then at the beginning of the month, people move in and out of shelters, and you'll move in and out depending on weather. And so at the different time of the month, you'll get a different answer. That's why point in time is a highly inaccurate sample, and I think the federal government will be changing how that.
So how
many days did you guys do?
We did it over a couple-week period. Mm-hmm. Did it at different times of day, different days of week, and such. And I think we had a 60% penetration of completed surveys, totally accurate. I can go back and get, but it was north of.
But how many is that?
What was the total amount?
Out of the 60% out of all the people we saw on the street, which is statistically significant at 99.5% level.
Except that our homeless services system serves over 7,000 people a year, and what you
that was not the target.
What you observed 403 people, so maybe 215 of them completed a survey. Is that what we're talking about?
The target level, the target group was street level homeless at 2 out of your 10 categories. We were not doing Department of Education definition.
Neither do we.
We weren't doing it. Well, you have to by law, so that means you're violating the law, because when you report it, you're supposed to report McKinney-Vento.
Well, hold on.
Yes, I understand that, but my point is
that's the Department of Education's definition. So if you're following the law, you're reporting those 5.
Hold on. I feel like we still haven't gotten a specific answer to the question, though. How many people actually completed a survey?
60% of the street level, and we have it in that number. I think it was like 405 or somewhere around
60% of the 405?
Yeah,
okay.
Correct. Completed survey, which is statistically significant, I think at 98%. At a confidence level, I think it was 5.8, somewhere around there.
So how does that work then if we interviewed 1,600 people between emergency shelter and unsheltered homelessness?
And it was a 30-point difference between your guys' report of around 50% weren't from Spokane, and I believe the
it's because
somewhere around 80.
I guarantee you, if they, even if you interviewed the larger sample size, which includes the other 8 categories, again, we only talked about the 2 categories of the people on the street. That's not, Point in Time is doing 10 categories. We only did the 2. We said that up front. We were very clear about that.
Our Point in Time for sheltered and unsheltered families and individuals was 1,600 people.
Families is supposed to be reported primarily through the Department of Education, through McKinney.
Requires that. Can you just?
Right.
So
we were
215 people completed your survey. Is that correct?
We were only doing 2 of the 10 categories. We said that up front. So let me ask: next year, will you commit here? Because HUD allows you to ask extra questions. With that same group of 1,600, two ways to solve this. One. Next year, ask how many people, where they went to high school. Do they have a rental voucher, a housing voucher, meaning the rental agreement, or a mortgage agreement, or a utility bill from 2 years ago? Ask where they were born, ask where they went to high school, ask the family. So ask the same questions. And if you ask those 3 same questions, you're going to get number within 2 or 3%.
Yeah, but I think our focus, though, is on drafting long-term meaningful solutions. And frankly, I wasn't born in this community. My parents didn't go to high school in this community. Brad Barnett, not from this community, right? So if we limited our data to people who are from here permanently to craft meaningful solutions to homelessness, we interviewed, that's irrelevant data to me.
We interviewed everybody on the street.
That's great, but where you were born does not tell me how I need to craft meaningful homeless policy. Yeah. It tells me that you believe people don't deserve care.
So no, that's not right. I'm saying that the people out of town, the highest chance of recovery is where your home is.
Not if your home's not safe.
If it's a domestic violence, totally agree. And we say that in the report.
There's a lot more than domestic violence. People's parents could be struggling with addiction. People's parents could be homelessness. I dispute your data entirely, but I also don't believe that just being sent home means you're safe.
The SAMHSA, even under the President of Biden, in their direction on how to treat care, even in a liberal administration, said your best chance of recovery is at home.
If home is safe. And you know what? This week, I approved 2 returns home, 2. Because we believe in that. And we do returns to family. We do it all the time when we know family at home is safe.
Why is it during the roughly 400 hours I was on the street here, not once did I see a police cruiser go by and stop and engage? I saw a lot of EMS calls, saw a lot of fire. With everybody who went out with our group, because we had multiple, we did have volunteers from the community and such that came in. Not once did we see a police cruiser stop.
You know what? I'm not law enforcement, and I agree that law should be enforced.
Why is it you have the second highest death rate of fentanyl in America? It's because you have such a permissive, open-ended. I saw so much fentanyl on the street here. You have one of the most permissive environments for drug use. And when I asked police officers, they said, we don't patrol for that.
I'm not a police officer, so I can't speak to that.
Yeah, but that's part of the problem.
Can we back up a little bit?
Here's why this is important. The largest study ever done on homeless in America by the Cal Policy Lab, UC Berkeley, UCLA, not a right-wing think tank. They found that at street-level homeless, which was the study of this survey, not the entire homeless, it was purely the street-level survey, 3/4 have substance use issues. 3/4 have untreated mental illness. Of that group, 50 percentage points say themselves their loss of housing was directly due to their substance use disorder. That's why substance use does matter.
No one's disputing that. We have said that since the beginning of Mayor Brown's administration. I said that during Mayor Condon's administration. Substance abuse is a challenge. However, the homeless system, as you know, was not designed to address behavioral health, right? It wasn't. So we need people like the county who control our local behavioral health funds to come to the table in a meaningful way. We need private partnerships to come to the table and partner. And we need healthcare to come to the table. Social workers working in an emergency shelter are not chemical dependency experts. That's not their job.
Pre-2013, the federal government funded, back then it was called wraparound services.
I'm aware. We still do that.
But pre-2013, it was a requirement that you participated in programs, and it was a requirement that you get substance use, mental health, or job, whatever the appropriate of those three is. After 2013, and you're one of the most radical adopters of Housing First in the entire country, you all said you can no longer let an agency have a requirement to have that, and you stop funding it. You basically come Section 8 without rules. You became just, let's give a voucher, let's give a voucher, give a voucher. That doesn't treat it. Why is your death rate double than what it was 10 years ago?
What I would love to say here is that our federal money and our state money and our local money fund wraparound services. They always have. We do not use our COC funds locally, nor does anybody, to my knowledge, for capital purposes. Some communities use them for rental subsidies. We do an incredibly small fraction of that. The idea in your report that Housing First has disabled wraparound services is untrue. We fund wraparound services extremely deeply with COC dollars, and I take deep offense for both the people that I fund and the people that we serve that you would propose that Housing First has stopped that from being possible. That is not true.
The best program in America right now is with Johns Hopkins University and Helping Up Mission, by far the most successful program in America dealing with substance use and homelessness. And they offer 65 hours a week of services, of which everybody in their program is required to attend 40%.
And they're a medical institution.
No, they're not. They are required to do 40%, 40 hours of treatment a week.
Who's funding that?
Private sector.
So locally, we have $0 from the private sector. So I would encourage you with your SBA partners to ask why the private sector is willing to publish studies with poor quality of data, but not come to the table meaningfully with investments.
This data
it's 200 people.
It's a 98% confidence level for your two groups we're studying.
Actually, I had a question about your data because you cited in the study that you relied on the methods of the Heidi Search Center, I believe, which is a now closed nonprofit that helped find missing people. Is that accurate?
They actually designed what's now used in most of America when
I'd never heard of them but these people aren't missing.
No, but it's a research methodology, so that way you walk every single street, you go every single foot.
What about the federally developed methods of research that were required to follow by HUD? What about those? Are those secondary to a now closed institute that helped find missing children?
The HUD is trying to find a different thing. HUD historically in the last 10 years...
we're not trying to find missing people, that's for sure.
Yeah, but you're trying to find everybody, and that's why that methodology, because it covers every inch of the road.
But you asked questions about where you're from. How does that help find somebody? If you can ask them the question, you know where they are.
No, once you find a person, you want to know where you're from, because if you're not from here, this is not the best chance of recovery. The best chance of recovery is when a person's at home. Full stop, period.
Clearly, we are not going to come to an agreement about the best methodology or what survey is best.
But I do want to make an offer. I think this should be I in my report said this should be replicated this summer, which it hasn't been.
SBA could fund that. That would be great.
And next time it's done, I would hope the city and county would come out and provide volunteers, which were asked last time. Next thing is next time when they do point in time count, they are allowed by law to add extra questions. You can't take away questions.
We do. We add extra questions.
Ask the 3 questions next year, and you will find that your data is going to be right on the mark. Ask, where did you go to high school?
You have yet to explain to me why I need to know where someone was born to inform homeless policy, so I'm not going to ask that question.
Because treatment, recovery is about knowing a person's life story and how they got there. And the fact that 50% became homeless somewhere else.
My data disagrees with that very strongly, so I'm not going to accept that as fact.
Here's why. You've asked a very bad question. If you had a bad question of bias, your question says, for this episode.
Okay, so where you were from is not a valid question. So I'd love to hear Emry's next question.
Actually, no, I have heard criticisms of both framings of this question. The criticism that I've heard about the where were you in your last bout of homelessness.
That's not what we asked. We asked, did you live here prior to this episode of homelessness?
To this episode,
to
that's
this episode.
Not their life story of how you started.
I'm a social worker, I know that. Thank you.
The criticism that I've heard,
right
the criticism that I've heard is that, again, somebody could have been homeless, moved to Spokane County, gotten into some kind of program, maybe was able to get housing of some kind, and then lost it and became homeless again.
Absolutely.
And that could be muddying the waters and indicating that people are quote from here when, by most stretches of definition or their own sensibility that they're not from here. What do you make of the criticism?
I think it's fair. I think we've long agreed that the point-in-time count is not an incredibly well-designed process. We've admitted that it's not even the data we rely on most locally to make informed decisions. It's required of us, of the federal government. It's provided to Congress. I have no choice but to complete it. The data we rely on locally to make decisions to inform policy is our HMIS data, which is far more robust and looks at a person's life story and includes their case history and identifies their family members. And that is the data we use, not your data.
If you're a social worker, you understand that the average person experiencing homeless generally goes through 3 or 4 bouts of homeless. They come in, out of homeless, they go out, they go in, they go out, they couch surf, they come back. That's reality. So when you ask a question so poorly as saying this episode, that by definition means you're going to cut by 1/4 the number of people who average experience homelessness.
Like I just said, we're not relying on that data to inform local policy. We're relying on our HMIS data.
You just said there's a difference between our data because our data is asking when you first started ever experiencing homeless.
The data that I rely on to make decisions is not from the point-in-time count. You all might be using that as the sample to compare your work to. The data that we use locally to make decisions is a far more robust data set, as you're very familiar with an HMIS, that we use locally in incredibly robust ways. That is the data from which I am making decisions, not the point-in-time count.
We could replay the tape. You just said the way you asked the question was this episode.
I have not.
That will explain the difference.
In the point-in-time count.
We ask from first incident, because homeless is not a straight line.
Would you like to hear how we do data in HMIS?
Homelessness.
Would you like to hear how we do data in HMIS? The mansplaining can stop.
Yeah.
I don't need you to explain the things to me that I already know. We look at data on homelessness from a very longitudinal perspective within HMIS.
You said just a second ago, you asked the question differently. If you asked the question from when you first ever started experiencing homeless versus this episode, because homeless is episodic, and so it artificially
Did you hear what I just said
it.
about HMIS, where that's the data we use to make informed decisions? As Emry said, the point-in-time data, that's the one time we ask that question that way. It's not where we base policy decision from. The data we use to inform policy comes out of HMIS, which is transparently made public on the SRHD website. We present on it quarterly in front of City Council. That data is very available. The point-in-time count I've long acknowledged since I worked in Seattle, that this is not it's a snapshot in time. We are aware of that. That's why that's not the data that we use to make policy.
So
do you think there were any limitations
I'm
with
not
the
from
study?
Seattle.
Okay, you said you worked in Seattle? Maybe I misunderstood what you just said. What did you just say?
I worked in Seattle.
Okay, so this question with the exact survey, same methodology, has your chronic homelessness over 2 times what it is in Seattle. Same methodology.
Are you calculating chronicity from your survey?
What's that?
Are you calculating chronicity from your survey?
It's the definition from first experience.
Are you basing that percentage on the information collected in your survey?
It is when
That's a yes or no question.
The question being asked is when you first experienced homelessness.
Are you asking if we define? Are you saying that we have 8.6 years of homelessness based on your data? Is my question.
No. The point is, even if there was error, the same methodology used the same way, done the same way, Your number here is twice as long
What
as
number?
Seattle.
What number?
4.2 in Seattle. You're 8.7.
But where did you get the 8.7 is my question.
Yeah. Oh, the survey we just did.
Yes, but your survey is not
Please
real.
come out and do it. Come out and do it with us. Then.
I've done the point in time many
let's
times.
move on.
I'm not
Let's
gonna,
move on.
I'm not
You
going to
just
respond
said
to a
point
fake
in time
fact.
was bad. You just said
I'm not going to
point in
respond
time
to
was
a fake
bad.
fact.
Can we move on? Obviously, we don't agree on the methodology. I want to talk a little bit about the report's recommendations. So can you walk through a little bit about what your policy recommendations were for how we should respond to, as you see it, half of the homeless population?
When
not
homeless
from
was
here?
way down in Spokane pre-2013, roughly 1/3 of the money was going to emergency services and direct treatment, recovery, and back then it was called wraparound services. I think
it's still
you
called
got to
wraparound.
It's still called
services.
that. For the record, the city's never funded treatment. That's a county function.
understand that.
Well, it's important to the conversation.
But when HUD money used to come to this city in pre-2013, and by the way, in 2013, people said if you adopted housing first, it would end all homeless in 10 years. That was done by the administration. That was done by the advocates. That was actually done in writing in a strategic plan released by President Biden.
Sure. I mean,
President
I've
Biden in
heard.
2013?
What's that?
President Biden in 2013?
And Obama and Biden, and then when Biden came in, he brought it up again. And so 10 years later, it did not end homelessness.
Sure. I'm assuming there was some like 5-year plan to end homelessness.
No.
Statement
This
like
was
that.
in the government plan when they announced they were moving away from wraparound services, away from emergency services, and moving into permanent supportive housing.
Sure. I mean, I generally don't like to deal in absolute statements in any case because they're just absurd on their face.
Well,
nobody is going
that
to
was
solve
made.
the problem.
That was the argument made to do this.
Sure.
So pre-2013,
As I understand it, the argument was also just that it would be better at getting people out of homelessness.
And it's in homelessness in your part of the world here is now doubling every 4 to 6 years. That's your level of street level homeless is doubling right now.
Sure.
That's the fact.
Well,
Just look out the
I know
window.
that there's a lot of
Come
arguments
drive
for what's
around with
drawn.
me right after this, and I'll show it to you.
I mean, look, I know that the pandemic was a role. I know that the emergence of fentanyl has been a big role, but I want to get to the specific recommendations.
So
not the preamble, but what are the specific recommendations?
1/3
in this
your
report?
total budget should be going to direct emergency services, 40 hours a week, substance abuse, mental health, behavioral health, job training. It should have requirements to it. Everybody in each of those facilities should be required to do it. Number one. Number two, you have to have
people in a treatment facility are required to do the treatment, or requirement for what?
whatever
For housing?
program you're in. You should have a requirement, a 40-hour-a-week requirement to do a positive work. Some will call it a work week. It's really a treatment week, but 40 hours of treatment.
In order to receive like shelter services?
Whatever it is, whatever the program is, all of them need to have that if you want to be successful. Number two, you have to have a clinical track, not Greyhound therapy, it doesn't work, but a clinical track on in-town and out-of-town people. What is needed is different. Your best chance of recovery is not away from home. The best chance of recovery is away. And then third is you absolutely have to start patrolling these areas. And the best practice now in America has a police officer, a social worker, and a medical, like an EMS, EMT, EMS.
Sure,
in our
we have
state, maybe an
co-responding teams.
EMT A or B. And you go out as a 3-person team, and you go out and patrol the streets.
Sure.
The fact that I never saw a police officer I saw plenty of EMS, I saw plenty of fire. I was down here probably 300 or 400 hours in the area. And I asked police officers, I said, why don't you stop and do the fentanyl? I said, we're told not to patrol for that.
Not to patrol for.
That's what your officers
drug use?
told me on the street. They said, don't
Well, not
patrol
my
for
officers,
open
but
use of
also
drugs. Yeah,
not Don's
I
either.
asked officers. I stopped officers, and they said, we're told not to patrol for
I
that,
thought you
not
didn't
to
see
arrest
any
for that.
officers in your
No,
300 hours.
outside the zone, going to restaurants, going to other parts of the zone. I said, why didn't you go in there? You go up by the mall. I talked to 3 or 4 officers.
Okay, so we
So
don't
you
have our
see it,
police
so it's
chief.
confusing.
We don't have our police chief here today. We don't have our mayor, but so I want to stick to treatment services, to homeless services.
I also asked to meet
just really
with the
quickly,
mayor while we were here, and he did not want to meet with
It's a she.
either.
It's a she.
It's Lisa Brown. Just to clarify, you said not Greyhound therapy, but also that people who have family elsewhere should be sent there. How is that different from Greyhound therapy? And then I want to get your reaction.
The people, Alvin Chapman, who invented the first family reunification model. What you do is first you case manage a person here, make sure it's not a domestic violence. That's in particular you do not want to send back. Then you connect with the family or a treatment program there, preferably both. And when you go out, you also have a person go with them to that location. The best programs now have somebody who escorts you with you.
I've never heard of a program where there's actually that kind of follow-up.
Manatee County's doing it now. Miami's doing it now.
They travel all across the country with people to return them?
Alvin Chapman's actually traveled people overseas to get people there.
How is that funded? Because government money wouldn't pay for employees to travel like that.
Manatee County is actually a contract of the county services of Manatee County,
so the
Florida.
county itself must be funding it.
Yeah, the county funds with the nonprofit to do that, and they get them there. And then when they get them there, then you make sure they get into the thing. You don't just a Greyhound ticket. All they're going to do is come back. That won't work.
Because my understanding is almost all of these programs, there is a little bit of a handoff, but there is not a lot of follow-up.
But that won't work. That's not what we're arguing for. We're arguing for a real thorough where you do pre-case management, you find out what the likelihood is, whether it's family or the location, and a person actually goes with them and arrives there.
And what are the qualifications for somebody to get the You're From Here treatment?
Well, every community can do it. My division in looking at the data would be at 2 years. So anybody here 2 years or longer. And the great thing, you can look at HMIS and see if they were on the records 2 years ago, or if they went to high school here, born here, have family here, had a rental. The great thing, everything we talk about is out in open market. You can do some little searching. You can buy an app and get all this information online now. It's all open market. You could go look at utility records. There's a lot of ways you can define it. You can define it looser.
So you
or
want
tighter.
people to be able to prove that they have been here for 2 years, not just some kind of...
Well, you can easily confirm that. If somebody says they're from here, you can go online and within a matter of 2 or 3 minutes confirm any of the data that we have.
Sure. What do you make of these recommendations?
I mean, on this one specifically, we do reunify people with family. When we can reach somebody at the destination, we can ensure that there's a place for them to go. We can provide, to your point, follow-up services to the best of our ability. We're not funded at a level that would allow us to send staff all over the place. But we do reunification with family anytime it is safe and we're able to make contact. We agree that if home is safe and people want to be there, that's a fantastic outcome.
But I mean, how many are we talking? What are we talking about for an average year?
We haven't pulled that data in a little while. I mean, I approved 2 this week. We had, quite a few as track was closing that we were able to return home to family. So our shelter providers do that really well whenever it's possible and safe. It's certainly not at a scale that's going to, resolve the crisis that we're experiencing. But for folks who can do that and it makes sense, we're of course going to support it. I think some of the other, recommendations from the document are a lot of things we're already doing. I mean, the city. We do fund outreach workers to work with police departments and our street medicine team that we fund to send people out in groups with medical providers, police officers when appropriate, outreach workers to do exactly what you're describing. So I think part of what was a little bit confusing is that we do a lot of those things. And the mayor has been saying, I think since her campaign even, that she agrees, that compassionate enforcement and expanded access to treatment are critical to the work being done. So, I think there's a lot in there that makes sense. I think there's some challenges with some of the recommendations that do not work within current state and federal policy. And I'm not the state or the federal government, so I think there's some things in the report that certainly need to be advocated for at other levels of government.
Do you think
Can I hear his question, please?
Yeah. Can I ask her a question? City of Philadelphia.
Well, I'd like to hear his question first.
Well, I was just going to ask, do you think that there should be a mandatory cutoff that if you hadn't been here for 2 years, that you should not have access to the majority of treatment services?
No. I think that, I think part of what I believe in enforcement for illegal activity, as does the administration. I also believe that humans have inherent value, and that if somebody is in our community, regardless of whether or not they were born here or their mother is here or they have roots here, that we should show them compassion and dignity. And that includes being willing to provide them with a meal or a shelter bed if one's available, or connecting them to treatment. The idea that somebody would come to me and say, I'd like dinner tonight, and I would say, sorry, you're not from here, is appalling. So no, I don't think it's I don't think it should be a requirement that if you're not from here, you have to leave.
That's not what the report says.
Well, it's the two tracks you're offering. Is if you're from here, you can stay. If you're not, please get out. That's the recommendation.
The report says we'll give you a defined period of time, 1 week, 2 weeks. You can even go to 3 weeks. And you said during that time we do family reunification. That's what the report says. So make sure you read the recommendations.
I've read the recommendations, but 1 to 3 weeks to reunify somebody is not something that I'm going to say is best practice, nor is any other research body I've seen.
Let me talk about a place that is the most similar I've ever seen to you in terms of bad drug use in the homeless community on the street.
Did you know that housed people use a lot of drugs too?
Which is in Kensington District in Philadelphia. The mayor of Philadelphia.
I've never been compared to Philadelphia as Spokane, Washington. That's a unique one.
But you have the second highest death rate now. You have a death rate because of fentanyl and interconnected with homelessness.
Did you know that housed people are also dying of fentanyl? Did you know that? It's shocking. It's actually a higher rate of housed people dying. Well, start from facts. More housed people are dying of fentanyl than unhoused. I would appreciate the facts being on the table.
Not in a raw number, yes, but not a percent of capita, because there's 1%.
So raw numbers don't matter in data?
No. 1% is homeless versus 99%. So that's going to be an overweighted sample. Your data is really bad. So Philadelphia. Liberal mayor.
Very like us, yes.
Yeah, Kensington, probably the only place I've seen worse than here in terms of drug use in the homelessness community. When she got in, she said, I'm going to engage. So the prior mayor had cut out the faith-based groups. She brought the faith-based groups back in. The prior mayor was not patrolling the area, whether it was passive, permissive, or by direction. She took the first 3 classes of police academy grads. So if 68 people graduated from the police academy, I'm just picking the number. She put all of those people in the Kensington zone. And she did that for 3 police academies. She flooded the zone with the new officers. And then she found out that the officers that were going there were the least experienced, so she moved them around. So if 68 graduated, she took 68 from the entire force, put in the zone. So will your mayor patrol this area that right now is the worst I have seen in this country? Would she be willing to say the next police academy class, say it's 40 people, put 40 of your officers in, then add another 40 until the numbers get down?
So I think we've established I'm not the mayor nor the chief of police. And the mayor has
committed. You're representing her on other issues. Why can't you represent her on this issue?
I'm not the expert on policing. And our current police chief and mayor have increased law enforcement presence downtown. We have done a lot of work with our police department. We've added different schedules. We have brought new officers into the downtown core. We have officers in academies. They are working very proactively with our social work agencies. We're committed to that.
Compared to San Francisco, Austin, Houston, Philadelphia, liberal, Democrat, predominant councils.
So one question I have here on that note, though, is
they are actually increasing patrols very precisely.
That's great, and I will let the mayor know that she should go talk with them. But I think part of my question to you too is that she has been in office for 22 months, and the past 12 years were conservative mayors. So the idea that this entirety of the problem is born on the back of a progressive mayor does not make sense to me when she's had 22 months in office. Right? And we're making a lot of assumptions here that the fentanyl crisis is uniquely worse in the homeless population. And I understand that you spent 300 hours in the downtown core, right? But we serve 7,000 people a year who are homeless, right? And you talked to 200 of them. So the idea that they are uniquely bad or unique to the problem and the ability to conflate homelessness with criminality is where I take opposition. The vast majority of our homeless individuals and families that we are serving are engaged in the workforce, are engaged in education, are engaged in housing, are engaged in treatment. The vast majority.
That's why, if you read the report, it says on the very first 2 or 3 pages, I think 2 or 3 times, we're only studying 2 of the 10 areas, and these are the 2 areas that are causing the most damage to this community.
But you're conflating homelessness as a whole with the issue.
I never
Yes.
did that.
Your report and the
specifically-
people paying you absolutely do that.
The report absolutely doesn't. It even
I disagree.
defines the two. I encourage anybody to go read it.
I do too.
And it says,
I think your data is also bad.
And the data is absolute statistically
You don't
accurate.
even tell us how many surveys were completed. How would we know that?
I'm happy to give you that. Tell you what,
I've asked Gavin for it many times.
If you agree that you will ask those three questions,
I will not do that. If I have to
listen, if you will agree to ask those three questions, I'll give you all the raw data today.
No, if I
you
have
agree to do it, if you agree to do it, no.
If somebody wants to examine a survey to understand if they should trust it, to see if there are gaps in the data, they would want to look at the raw data. I mean, I personally did have to request to be able to see the spreadsheet. I was not able to get a copy of it. I had to work on it in front of Gavin Cooley. I guess I'm just wondering, like, why should somebody have to give a concession to be able to get access to raw data?
Because she says there's a reason the data is different, and it is because if they ask those three questions, I guarantee you their data will be
unless I
within a
concede to ask
margin
your
of
questions,
error.
I can't look at your data, and I take issue with that. Our data is public. Anybody can go look at it. We'll provide it to anybody.
All
who
I'm
asks.
saying is, why don't you ask why are you afraid to ask those?
Why are
three
you afraid to
questions?
give me your data?
I got the data.
Then give it to me.
So one thing that I do want to talk about, again, you're not the police chief, you're not the mayor, you're not the city council, but obviously you see the impacts of policies on the populations that you work with. Obviously, we are currently in the process of trying to reform the home ordinance, which is our anti-camping law. We had seen no citations. Nobody was accepting services from the police under the current law. Why do you think that wasn't working? What do you want to see different?
So I think, part of the home ordinance when it was brought forward initially months ago for consideration included two projects that launched last week, and I think those are going to be really critical to the success. One of those is the Daytime Navigation Center at the Cannon Street facility, and the other one is the substantially larger investment from the city in street outreach that does align with police precincts and engages directly with our NROs and our street outreach medical teams, et cetera. And those things were very critical to the home ordinance language when it was initially considered. And so I think I'm excited to see how both of those things, now that they're online, start to create impact. I also think that we agree that enforcement is critical. I don't know a single homeless service provider who believes that somebody who's breaking the law should not be held accountable. So I think Chief Hall has brought forward some good recommendations to improve that portion of the home ordinance. I'm in complete support of that, as are the folks that I contract and work with on a daily basis. And I believe that this pivot in street outreach and the Daytime Navigation Center are going to be critical in ensuring that if folks are being encountered by law enforcement, they also have the ability to engage immediately in services. And we've finally got that piece made whole, so I'm excited to see where we can go from here.
I really would like that, because if it's a conversation like that, like she's been asking me questions,
Sure.
Let me ask her some questions. How many other communities have you been to compare yourself to? I've been to about, in the last 5 years, I've probably been to 600 communities.
Well, I'm not a paid consultant on homelessness, so my ability to travel is limited more substantially than yours.
Over half that time, I went on my own, voluntary, pro bono, go.
How nice. Yeah, that's great.
And
so, did you want to hear the answer to the question?
Yeah.
Okay. So specifically under Mayor Condon, we went to Boise, Portland, we did Denver, we did Salt Lake City. We've certainly been to Seattle numerous times. I've been to various other places across the country in my work with Catholic Charities and the Invest Health Group.
How many? 10?
Honestly, I've been in this field 20 years, so
Let's
far
go-
more than 10.
Okay, so let's go just 5 years. How many do you think you've been to in 5 years?
In the last 5 years, how many times have I traveled for work?
I guess I'm wondering what the point of this question
The
is.
point is, I'd like to look at those cities, okay, and then say there are 20 there. Then let's go look at another 20. I can pick 20, she can pick 20, and go look at it. And I will guarantee you're going to be in the top 3 worst of all those cities. The only 3 cities I know worse than here on the street is San Francisco and Philadelphia. In Philadelphia, both those cities have made radical changes with their new mayors.
You don't think New York City or Los
They have
Angeles is
changes.
up against a bigger challenge than Spokane?
Not on a per capita basis. You have to do it on a per capita basis, and that's why you run all the numbers on a per capita basis. And when you look at the fact that you have the second highest fentanyl deaths in America.
So can I ask a question on
and
that
you
point,
have
though? On the
the-
fentanyl point, can I ask a question. What has your conversations, and by you, the SBA, who's funding your work here, what have your conversations been with the county, who do fund our behavioral health dollars, right? They locally in our region administer all of our behavioral health funds. What have you and Gavin's conversations been with the county on this topic?
One of the things that I hear consistently asking city employees out on the street, when you see them, agencies, county people, and general public in this city, because I've been in this city, I think 6 times in the last 2 years, and probably been here 9 times in the last 5 when I wasn't paid to do anything and I was just here. You have literally the third worst thing I've seen in the country.
Can you answer my question?
So
What's the conversation been with the county?
I will ask that. Well, first off, they say you need more policing. That's what they say. But why do you think you're the third worst in the country?
So I'd like you to answer my question before I answer yours.
I did.
What have your conversations?
They said everybody consistently says you need more law enforcement.
So when you've sat down with the county commissioners or county behavioral health staff, their response has been the fentanyl crisis just needs more police. That's the county's response.
No. That you said. What would you do about it?
No, I said when you've met on the fentanyl topic, which you are repeatedly stating that fact, our county administers our regional behavioral health fund. So my question is, what have your and the SBA's conversations been with the county?
The fact that you have such permissive use on the street of fentanyl here.
But one of your priority recommendations is expanded treatment.
Yeah, absolutely.
And the county funds our treatment. So if you're investigating and doing your research, what have your conversations been like with the county when you've asked about expanding treatment since they control those purse strings?
Yeah, and I met with them too. I haven't.
And what was their feedback?
That they're going to start working toward trying to do that. Yes.
Oh.
Yeah. So you said you were going to ask the question. Why do you think you're the third worst city in America?
Well, first of all, I haven't seen your data sources on that. Second of all, we do have a fentanyl crisis. We've not been shy to admit that. We've had deep conversations at the mayor's office, with the cabinet, with our police, about why we believe Spokane is impacted so greatly by the fentanyl crisis. I'm not the police chief. I'm not a criminal expert, but our understanding partially is that I'm not done speaking.
Why is the fentanyl homeless problem then the third worst in the country?
So part of the conversation has been that we do have a unique scenario on the transit, with the I-90 corridor coming through our community. When we were in Boise with Mayor Brown a year and a half ago, maybe, we had a conversation with the mayor and the homeless team there. And when I said, do you have a fentanyl crisis here? Because we are really trying to get our arms around this and understand it, they had to pause. They don't have a fentanyl crisis there. And the primary reason that they indicated is that Boise is hard to get to. The ability to move drugs through Boise, Idaho is very different than it is in Spokane. I'm not talking about enforcement even directly. I'm talking about the fact that we are a major intersection across the northern part and the western part of this country. So the drugs do move here at incredible pace, as I understand from our law enforcement agencies. And it's become incredibly cheap over the years, right? It has continuously gotten cheaper and more potent. And it is killing people, housed, unhoused.
But Spokane is certainly not the only community with, a nexus of interstates.
No, and that's part of why we do have a crisis. I'm willing to admit that, and I'm not saying that.
But why? If you're homeless,
well, what did your survey teach you about why fentanyl is our biggest crisis?
Because you lack of enforcement on the street.
The people that you interviewed said the reason.
No. I'm just talking straight observation. I'm talking straight spending hours and hours on the street. Well, I actually spent the night, lived on the street, and walked around here.
You spent
the current administration.
Yes, I've done that twice in the last 5 years in this community.
Just walking around downtown all night.
Yeah, like overnight, slept, spent the night there. That's what I do when I go to
The current administration has been in office again for 22 months. Is your understanding
doubled the police force downtown? I think we've almost doubled the number of officers in the downtown core.
You don't see it. Now, here's the
so it must
strange,
not be true.
Here's a strange thing that I've seen here. I always look at dogs. I know that's an anecdotal information, but when you see encampments,
where it was a controversial comparison.
Yeah. But when you see more dogs in encampments, and the dogs get bigger, they go from like rat terriers to pits, American standards, shepherds, and such. What you know is that's a leading indicator on violence.
So our violent crime rates in Spokane are down. And that fact in your report stood out to me because there's also a lot...
In the homeless zone? In the homeless zone? Is it if you're not patrolling
What's the homeless zone?
So go
You mean downtown
go about
or?
4 miles this way, either side this way. Go about 2 miles either side this way.
4 miles that way, we're in the middle of nowhere.
Yeah, but I said we're on the
but
edge
you keep
of
saying
it.
the homeless zone. What is that?
But if you look at that area,
No answer.
and look at that area, do you think there's more crime there or less crime? Not crime being arrested, because if you're not patrolling it, it won't have a high number.
I'm simply reporting what I have heard the police chief say, which is that violent crime and calls for service are down in our community.
And these areas
I don't
have
have
been
a
a
homeless
problem for
zone.
years.
These areas have always been challenges. We know that they are there, but is it a homeless zone?
Can
I'm
you
not
answer
sure.
the question? In this area of downtown,
Yeah.
right here, is it better off today than it was 2 years ago and 4 years ago?
Compared to, like, just on what stat are we talking about?
Homelessness number, homelessness challenges, treatment for people getting out of homelessness increasing, fentanyl use within the homeless community. Any of those?
Well, what I can tell
Are you
is
saying
that
it's better than it was 2 years ago?
So 2 years ago, maybe a little bit more than 2 years ago, the prior mayor, Mayor Woodward, held a press conference in the middle of what I'm assuming you're referring to, the downtown zone of homelessness. And the problem was indeed much worse. She held a press conference with the police chief stating all kinds of enforcement activity would happen. At the time, I was working for Catholic Charities. She held that press conference right outside our property without ever speaking to us. We didn't see any increase in enforcement at that point in time. The neighborhood did not get better. When Mayor Brown took office...
There was certainly an increase in enforcement during the emphasis patrol period.
We did not experience that, but I'm glad that somebody did. That's great. When Mayor Brown took office, we made an incredible impact in that neighborhood. And in the last 3 or so months, it has gotten escalatingly worse again. And we acknowledge that. But we have done a lot of things to make it better. We have invested far more resources into things like street outreach and street medicine than have been done previously. We are moving the needle in ways that actually matter and count, that are far separate from the point in time data.
What do you think has been happening in the last 3 months that has caused some of this backsliding?
I think there have been challenges with the home ordinance. I think Chief Hall has spoken very plainly to that in public meetings. I think we acknowledge that. That's why there are changes being brought forward to make a shift there. We always know that in summer things fluctuate in our community. You referenced in your report the impact that weather can have on the unhoused population. So we admit that those things are part of the scenario. But I'm not going to in any way, shape, or form suggest that we are worse off today than we have been in the past. There is a complicated scenario presenting ourselves as a fentanyl crisis. It did not start under this administration by any stretch of the imagination.
And it's happening everywhere in America, but why are you one of the worst?
Yeah, the data does not support what you're saying. So I don't have an answer to that.
So are you not accepting the data that you're the second worst in fentanyl deaths in
I don't
America?
have your data source on that, and I've not been able to see something produced by the SBA when asked, and we've had folks reach out to the SBA to try and find that data point, some council members included. We haven't gotten a response. So I would be happy to look at that data if somebody could give it to me. I haven't seen it.
Yeah, nobody's asked me, but I can't
Well,
get
we've
it.
asked the SBA, who's our local contact. That's
As tense as this conversation has been, I've been really enjoying it, but we are running out of time. So just to close out, I would like to give each of you some time to talk about your thoughts on how to improve things. To summarize it, I know I've been talking about that for 30 minutes, however long it's been, but what are your thoughts?
Yeah, I mean, I think that we are really excited about some of the direction that we have taken. We know that we have an uphill battle in front of us in terms of fentanyl crisis, and we also know that we have some really exciting pilots on the ground and some great movement happening in our homeless system. A lot of the data from our most recent longitudinal systems analysis had really uplifting results from our transitional housing projects, our rapid rehousing projects. We're looking at 68% placement in permanent supportive housing. In some of those projects, we have a 93% retention rate. In many of our permanent housing projects, we know that our scattered site models are producing higher housing placements than our traditional shelter models have. The Navigation Center had a 40% placement rate into permanent housing options. Catalyst is over 34% placement into permanent housing options. We're very excited about the encampment resolution program now being under the city's leadership. Watersmeet did an incredible job. We're excited to build on that and continue to respond to encampments. The success rates from those efforts have also been very, very positive in terms of long-term housing placement. We've also made some really exciting investments. We are the first mayoral administration to invest any of the city's opioid funds into this community, and we've invested deeply in co-responders responder teams, expended hours for behavioral health response units with both police and fire and social workers. We've invested in critical programs like Maddie's Place, which address opioid use in families. We'll continue to spend those funds to the best of our ability. And we've done some really exciting work in the downtown core around, during the prior Woodward administration, the alcohol impact area was left to expire. We were bringing that back. We're already hearing good feedback about that from downtown
Just
stores.
a brief explanation of what that is, the summary.
So the alcohol impact area essentially bans the sale of certain products during certain hours of the day or throughout the day to reduce alcohol consumption and therefore enhance public safety. That expired under the prior administration. We are currently in the pilot phase of bringing that back. So we are tackling policy from a variety of angles. We know that we have a long way to go, and we feel really optimistic about where we're headed. I think the thing that we want the community to understand is that, when we simply boil homelessness or addiction down to a political issue, we are harming people. And the idea that we can rely on politically funded studies or politically funded agendas to teach individuals in this community the truth about what the struggle is and how we will solve it is when the public starts to not trust us. So we're going to rely on the fact that we do incredible work with incredible agencies in this community. I have never been more proud of the staff that we fund on a day-to-day basis and the clients they serve. And we're going to continue to do that. And we're going to continue to challenge individuals or companies or agencies that come to us and tell us how horrible we are and how bad we are at our work and how everything is failing. Because in my day-to-day work in this community, where I live full-time and have for a long time, we see incredible success and hope on a daily basis, and we're not done. But it doesn't mean good things aren't happening. It doesn't mean our community is the worst, right? We have an incredible community, and people who live here full-time know that. So we're going to keep doing the good work. We're going to keep advancing the really critical policy perspectives of this mayor, who's only had 22 months in office, yet has faced unimaginable amounts of scrutiny for problems that we inherited, including the budget. And we're going to continue to support the staff that do this good work, because one thing I think the community needs to understand is that these are incredibly hardworking people, day in, day out, in the hardest of jobs, making the least amount of money, who are constantly under attack, and we're tired.
Robert.
I would encourage any viewer, listener, go look at San Francisco, go look at Philadelphia, go look at Austin, Texas, go look at Houston, Texas. All four of those have brand new mayors in under a year. All four of those have Democrat mayors. All four of them have come in and said what they were doing was not working and they were some of the worst. All of them have now made radical changes toward proactive enforcement, toward treatment, and toward recovery along the lines of our report. Everything in my report has been adopted in those four cities in some form of fashion. And so it's time now to realize if you have one of the worst cities in terms of homelessness and one of the worst fentanyl problems, how did you get there? Why did you get there? And just saying everything's hunky-dory and it's all going well, I guarantee you is a path toward failure. And other cities have started to realize their mistakes and have made those changes. So I'd encourage you it's time for radical change, not keep doubling down on what's not worked.
I really appreciate you both taking the time today and agreeing to meet. Again, a very tense conversation, but I think it is helpful for people to hear it play out again in real time. So again, I appreciate you both. Thank you.
Thanks, Emry.
Thank you. Thank you.
Thank you.